Psoriatic arthritis, or PSA, is a painful and debilitating chronic condition that affects up to 1 million Americans. But this number may be even higher, given that the disease is often misdiagnosed and underreported. PSA may impact mobility in patients' daily lives at the most basic level. Some patients actually have trouble walking or climbing stairs. Joining us this morning are Dr. Jason Fowler from Mount Sinai Roosevelt Hospital in New York, as well as PSA patient Lisa H. Good morning to both of you.
Good morning to you.
Good morning.
Well, I think a lot of us certainly are familiar with arthritis, but tell us, doctor, a little bit about PSA and how that differs.
Psoriatic arthritis, or PSA, is a chronic inflammatory condition that involves the joints. It occurs in about 30% of patients with a skin condition called psoriasis, and as you mentioned, it can indeed affect mobility and the ability to perform the daily activities of life, hobbies, exercise, going to work, and functioning in the home.
And Lisa, certainly we thank you for sharing your story. Tell us a little bit about how your symptoms were diagnosed and what it's like living with PSA.
Definitely. When I was 35 years old, I was diagnosed with psoriatic arthritis. I was very shocked because I never heard of it before, and I thought arthritis was something that older people got, not somebody in their 30s. I was getting the swollen joints, unable to move like I'm supposed to. I was having trouble opening things, taking care of my kids. Went to the doctor, and with the help of my rheumatologist, they put me on Otezla, which I'm able to manage my condition and have a quality of life now.
And doctor, she said she was diagnosed in her 30s. How common is that?
Generally, patients with psoriatic arthritis are diagnosed between the ages of 30 and 50. There is a broader range in which the disease can actually occur, but as we said, so many of these patients are not diagnosed. They have aches and pains, back aches, painful feet, painful knees, and they may have the skin disease, but they haven't put two and two together.
Okay, and I understand there is a new initiative to sort of reach out and help others. It's called Be Counted. Can you tell us a little bit about this?
Absolutely. Be Counted is the initiative to educate the public, educate patients, educate families, educate friends, co-workers, and physicians on the condition of psoriatic arthritis so that we can make a difference, we can make people aware of the condition, and make sure that people get diagnosed and treated properly. And the website is psacounts.com.
All right, and Lisa, obviously you're taking part in this, sort of reaching out to others. What is your advice to others out there who might be living with this condition?
My advice is talk to your doctor about different treatments to help with psoriatic arthritis. With it being a chronic disease, it's something that people don't see with the naked eye. So people don't understand why friends can't go out with them, or why they can't do a daily activity, like doing laundry or driving. It's a very serious condition, and you can get help by going to the Be Counted campaign, so that you can look at the different symptoms that people have, talk to your doctor, and see if it's something that you have.
Well, certainly we thank you both so much for joining us today and talking more about this. Doctor, can you give us that website again one more time for our viewers?
By all means, the website is psacounts.com.
All right. Well, Lisa, thanks so much for sharing your story. And doctor, thank you so much for joining us today. Certainly an important topic.
Thank you for having us.
The preceding portion of Daytime was sponsored by